Good morning, everyone. I'm Stacy Williamson. I'm currently the state president of the Missouri State Teachers Association. I represent 45,000 teachers across the state of Missouri. We're well over 150 years old in Missouri, so I come to you with lots of teachers represented. With that, I am also a mom. I have two little girls, both little swimmers, who will be swimming tomorrow night in a swim meet. They're very excited. Um, Having been a teacher for the last 15 years, I kind of come with you with a set of several stories. So the school that I teach in serves a highly impoverished urban area. I teach in Kansas City, Missouri. So if you know very much about Kansas City at all, it's kind of a really large, sprawling area. The area that I currently teach in, I teach in the North Kansas City School District. It's the sixth largest district in the state of Missouri. The part of the area that I'm in North Kansas City is extremely urban. So we have 40 languages. We are 85% free lunch. That's not free and reduced. That's free lunch. So we have universal free breakfast every day. My classroom looks like a UN meeting every day. So it's not just African American students or just white students. Most of my Caucasian students are not American born, they're Bosnian. We have a very, very large Bosnian population, so they are not American born Caucasian students. They are mostly Middle Eastern students. Our number 3 language in our building is Arabic, which I thought was really interesting. That took a turn about 5 years ago. So we serve quite a variety of students, along with being, all the things that come along with serving a high poverty population. So I can go on for hours and hours and soapbox to you about what it's like to serve a high poverty population and the things that come along with serving students in poverty. I teach in a middle school. I teach 7th grade social studies. So being able to teach social studies with kids that come from countries all over the world has got to be the best and most magical thing ever in the world. So when I talk about countries and things that happen in Egypt, and I have kids that are from Egypt, that's really awesome. When I was talking about things that are going on in Sudan, and one of the kids was like, hey, my grandpa was actually one of the lost boys of Sudan. He could come in and talk. And I was like, let's do that. And his grandpa comes in and he talks to the kids, and it's like this totally amazing opportunity. We get to do these things in my classroom that, don't happen in other places in the world. And I live in Missouri, that you don't normally get to see. We're stuck in the middle of the country, and, it's a pretty awesome time. So the things that are going on in my classroom have been just really magical, just because we have a lot of refugees and things like that that have been brought to our area. So the things and the services that we are allowed to provide in our city and in our school are very unique to us. We have a full-time social worker. Our community services, like the community health services, we provide immunizations in our building. We cannot rely on our parents because a lot of them don't have vehicles. They rely on public service and transportation. We bring the shots to the kids. Otherwise, we can't have our kids in the building. We'll like, oh, you don't have your shots. Well, then there's like 100 kids not at school. We can't have that because then it messes up our attendance, and you know what happens to that. So we bring all the immunizations to our school. So we're providing all of those services, and they're very, very critical. Which brings me to the next story. Poverty begets lots of other things. Because those parents are often not educated, which the slides showed earlier. Thank you very much for those, because they're going to help me with the next piece. A lot of our highly impoverished parents don't have that education, so they don't talk to their kids, they don't read to their kids. So I have 7th graders in my classroom that read at a 3rd grade level. So my 9-year-old reads better than the kids in my classroom, which is super frustrating. Because of that, we do have things in our district, but not all of our parents take advantage of it because they don't always know, and they don't always know to take advantage of these services, and that's a huge frustration. We have a program which is kind of like, I'm guessing, like a Head Start, but we have what we call Parents as Teachers, and it's from birth till the time they start kindergarten. So as soon as we find out that folks are pregnant, they live in our district, we get them enrolled in Parents as Teachers. So as soon as you have your baby, you're home, these teachers come into your home and they provide these services. They give you handouts, they play games with your baby, they come straight to you so you don't even have to leave. We also have a center within our district. You can go take your kids for play dates and really great opportunities. So let me tell you a little bit about my two so we can get more to the fun stories. So my first child is Anna, and Anna was 41 weeks, so I thought she was going to be a permanent resident. And I was really anxious for her to come along. And she was amazing and magical, and she was this really skinny, scrawny baby, had no fat on her, and I was like, really, this is it? Where's the fat and all the rolls? And she was amazing and never cried, and she was this like really awesome baby. She did really well, and we were excited when we had parents as teachers come in, because I knew about this stuff. You know, I have 2 bachelor's degrees. I have the master's degree. I have my specialist is almost finished. You know, I have all this stuff. I know what to do with this baby. And then we got into kindergarten, and they're like, she's really smart. She gets this stuff. We're like, yes. They're going to test her for the gifted program. I'm like, yes, we're on our way. This child is smart. We're excited, right? Things are awesome. We're going really well. They put her in the gifted program. I'm like, yay, mom of the world, right? You know, we put her on the swim team. She's like hanging on the side of the pool, screaming her eyes out. We're prying her fingers off. I'm thinking, really? We're paying how much money for this? My husband's having a cow, right, on the other side of the pool. Like, no way. Because I was a swimmer. Anyways, she's now going to the Junior Olympics this summer. We're super excited. So this is my now 9-year-old. So she's doing really, really well. Fast forward, because I saw my 5-minute warning, to the little one, Afton. She's the cute one with the short hair. She's what her preschool teacher told us, described as the bouncing ball of sunshine. When she was born, we had the surprise diagnosis of spina bifida, which was a shock to us. It's not severe, otherwise she would not be swimming or diving. But the fact that she can do those things is amazing, because we never dreamed she'd get to do that. And the fact that we have to go and have her scanned every year to make sure that her spinal cord didn't retether is huge, because it is scary to go every year and pray that it hasn't retethered. This is so scary. Sorry. And to know that she can do the things that she does, but we know that she's behind academically. So when she went to kindergarten this year, we knew that it was going to be really hard. And as a teacher, I knew that it was going to be a struggle. Sorry. Because I have a child that's gifted, and one that I know is going to struggle for a really long time. So when her teacher in preschool said, she's a bouncing ball of sunshine, is the greatest thing ever, because she is the happiest child you will ever meet. She's always happy. She smiles always. She is never sad. She is truly the sweetest, happiest kid you will ever meet. And funny, like everything is funny. She's just the goofiest, happiest kid you'll ever find. Anyway, sorry. Woo. You wanted a personal story, now you got one, right? So anyways, Afton went to kindergarten this fall. So she just finished kindergarten. And thank you. She just finished kindergarten, and it is really hard being the mom and a teacher and know and get the reports that come home every day and see that she struggled and know that she's not reading on level, and know that it's going to be so much harder, and see that no, she can't sit still, because I know that horrible dimple, that hole that's in the bottom of her back, makes it hard for her to sit all day. And they want them to sit perfectly still in kindergarten and know that it's not possible for her, and know that it's always going to be a struggle from here on out. So, but also knowing that those services that we got going in before kindergarten and before preschool, and identifying and knowing, you know, we had speech services, and she spoke Aftonese forever because her name's Afton. We called it Academies. We knew the speech was going to be a problem because it got identified when she first started talking, because we had parents as teachers, we had those services. So we got speech services through Children's Mercy from the very, very beginning, even though our pediatrician said, it's cute, but it's not going to work. You need speech. We had, occupational therapy because she couldn't do some of those motor skills at first, but she does walk. She's a diver. She's a swimmer. No, she probably won't ever play soccer. No, she probably won't, play softball, but she can swim and she dives, so she can do those other things, but thank God for the services that we did get and that they are available. Thank you so much for your time.